when the hospital is hours away and every second counts. Master the art of survival. This is Survival Medic.
Hi, and thank you for joining us for this course on first aid for medical emergencies in the wilderness. In this course, wilderness medicine is defined as medical care performed in remote or low-resource areas where definitive care is more than an hour away. When you're evaluating a patient outdoors, they won't be coming to you and saying something like, "I think I'm having a heart attack," or "I think I have a blood clot." Patients will usually describe symptoms. It's your job to try and figure out what those symptoms indicate. Since this is how patients present to us, we're going to use a symptom-based approach as we think about remote medical emergencies. We are going to cover a lot of information, but it's not necessary for you to memorize everything. The most important things for you to remember are the basics. If your patient seems critically ill, doesn't seem to be responding to treatment, or seems to be getting worse, you should plan for evacuation. Evacuation means the removal of a patient from an area without adequate medical resources to a location with a higher standard of medical care. While there are many things we can do in a wilderness environment to help patients, there are many conditions that we're not capable of diagnosing and treating. In many of those cases, the safest thing to do will be to evacuate the patient. Now we're going to look at patients with chest pain. First, we want to think about what can cause chest pain. Chest pain can be caused by many things that affect the heart, the lungs, the ribs, the muscles, or the blood vessels in the chest. Common causes of chest pain can include heart attacks, acid reflux, blood clots in the lungs, and lung infections. Examples include pneumonia or bronchitis. Other medical conditions, such as anxiety or panic attacks, can also cause chest pain. Let's talk about some of the medical conditions that cause chest pain one by one. First, we want to talk about things that affect the heart. Chest pain can be caused by a condition called acute coronary syndrome, otherwise known as a heart attack. In this instance, the buildup in the arteries that supply blood to the heart blocks blood flow. The heart doesn't get enough blood. This is a medical emergency and causes a heart attack. Patients having heart attacks will describe a pain in their chest. The pain can be sharp or dull and often travels down the left arm. The patient may describe a feeling of heaviness, as if an elephant is sitting on their chest. Usually the pain occurs or worsens with exercise. Patients can also describe nausea, shortness of breath, or sweating. The patient may have a personal history of heart attacks. In the instance that you're concerned that the patient is having a heart attack, you should have the patient immediately stop and rest. You should ask the patient if they have a history of heart problems and if they have medication for it. Many patients carry heart medication with them, and if they do have that medication with them, you should help them get it. If they do not, and you have aspirin available, you can have the patient chew a full-strength aspirin. If you have oxygen, you can put oxygen on the patient. If you encounter a patient with concern for a heart attack, you should evacuate as rapidly as possible. Another common cause of chest pain is heart failure. Patients with heart failure usually have a known history of heart failure. They'll describe chest pain and getting short of breath with minimal activity, such as walking a short distance. When you evaluate the patient, you'll notice common symptoms like swelling in the legs. If you encounter a patient in heart failure, you can ask them if they have been taking their medicines and help them take their own medicines. Anyone having heart failure problems should be evacuated. Chest pain can also be caused by infections in the lungs. Infections in the lungs can be caused by a virus or bacteria. In these instances, patients present with symptoms such as fevers, chills, cough, and shortness of breath. They may also have sinus congestion. Treatment and evacuation depends on how sick the patient is. If you think the patient has a mild viral illness, such as a cold, you can try supportive care in the field. This would include things like resting, staying hydrated, and taking over-the-counter medications for cough and sinus congestion. If the patient seems to be getting worse, or you're concerned that the patient has pneumonia, you should evacuate. Patients with pneumonia will often have high fevers, shortness of breath, and maybe coughing. They may struggle to catch their breath. When you check their heart rate may be fast. When you check their breathing may also be fast. You may recall from course 1, a normal heart beats between 60 to 100 times per minute, and a patient will normally breathe between 12 to 20 times per minute. Other conditions that affect the lungs include pulmonary embolisms. A pulmonary embolism happens when a blood clot travels from the legs up into the lungs and impairs blood flow to the lungs. Usually, patients with pulmonary embolisms will have had recent swelling in one of their legs. They will describe severe, sudden onset of chest pain. The pain is usually worse with taking a deep breath. There are some things that increase the risk of a patient developing a pulmonary embolism. These include things like being on birth control, having a recent surgery, or having recent long travel. If a patient develops signs or symptoms concerning for a pulmonary embolism, they need to be evacuated. Treatment for pulmonary embolism is to start blood thinning medicine. One further thing that commonly causes chest pain is acid reflux. Acid reflux occurs when stomach acid moves up into the esophagus, causing burning. Patients with acid reflux will usually have a history of acid reflux. Patients will report that spicy foods make things worse. If you're concerned the patient has acid reflux, you can try over-the-counter antacid medications to see if the patient is improving over the next few hours. If there's no improvement, consider evacuation. In the next video, we will discuss patients with shortness of breath.
Be prepared for the unexpected. Get your copy of Wilderness First Aid on Amazon today. Link in the description.